To conclude the aggregate population of people with HIV, HIV is a virus that attacks the immune system, which renders the person susceptible to further diseases or infections. It can be spread through the blood, semen, rectal or vaginal fluids, and breast milk. HIV isn't curable, but there's treatment available in the form of antiretrovirals. HIV, if left untreated, can progress to AIDS, which is fatal within 3 years. HIV originated in chimpanzees in South Africa and was thought to spread to humans after infection with the blood from hunted chimpanzees. The late 70s is when the virus first existed in the United States. 38.4 million people exist globally with HIV as of 2019, and 12 million of them live in the U.S. Since 2010, there's been a 32% decrease of HIV cases. Most affected by HIV are gay, bisexual, or MSM, also known as men who have sex with men. The 2019 diagnosis statistics are age range of 25 to 29, African American race, and gay, bisexual, or men who have sex with men are most effective. Heterosexual people account for 23% of new diagnoses. Testing for HIV is recommended once per year. 13% of patients don't know that they have HIV. Mental health support, mental health and emotional support is also necessary for those newly diagnosed with HIV. The medication, the antiretroviral for HIV, reduces the viral load, and the preventive medications can prevent HIV. HIV care continuum, 81% of patients, as of 2019, 81% of patients with new diagnosis who knew that they had HIV received follow-up health care within 1 month. The Affordable Care Act was passed, and included in that was Medicaid expansion, which is the largest coverage for HIV, and PrEP is covered as well. With the use of PrEP, prophylaxis, preventive prophylaxis, 95% reduction of likelihood of transmission of HIV. There was a plan that was developed by the Department of Health and Human Services under the presidency of Joe Biden, called Ending the HIV Epidemic, and that sought to end the United States epidemic of HIV by the year 2030. Some controversies in recent years. Well, as of 2016, in the UK, they had problems with distributing PrEP to the populace. They ended up doing a study with a test dose of 10,000 doses, and now it's available to the public under certain cases. Public health nurse core functions and essential services were discussed. And the public health service public health nurse core functions are assessment, policy development, and assurance, whereas essential services we have a wheel-like diagram. Because monitor health, diagnose and investigate, inform, educate, empower, mobilize community partnerships, develop policies, enforce laws, link to or provide care, assure a competent workforce, evaluate, and then research, final step there.